us. It's been a delight to have everyone this past couple of days. I'm really happy to see people are joining us in during our sessions, and then also during at their own convenience as we play this on Facebook Live to allow people time to go back and to hear from our speakers at their own convenience. Today's session is a year in reflection, reflecting on SUD prevention services during the pandemic. We have speakers today that will be talking about how they have been working during the pandemic in the last year, and also give a little bit about their personal self working during the pandemic, and just kind of, staying safe, staying healthy, and finding ways to deal with serving our community and also taking care of each other and taking care of themselves. So we have three wonderful speakers today. Our first speaker, our speakers today, and then I will have each one introduce themselves. First is we have Rawa Abarabi. Rawa is a navigator at Access and a public health coordinator. I'm going to also tell you guys a little bit about Ali, who is a health educator at Access, and Hala Mallah, who is also a health educator at Access. I'm going to send this over to Rawa. Rawa, if you can please give everyone a little bit of background about yourself. Unmute.
Sorry. Hi, this is Rawa Abu Arabi. I'm the public health coordinator at Access. I have been working with Access for 17 years. I do coordinate two programs, which is the Navigator program, which is enrolling people with Medicaid and marketplace insurance. It depends on their eligibility. As well, I coordinate a program that granted by Cigna, which is taking care of or providing health education case management to people with chronic conditions. So I'll leave my introduction to there and we'll go further with more questions.
Thank you, Rawa.
Sure.
Ali?
Hi, everyone. So my name is Ali. As Mona said, I am a health educator at Access. I work at the Access Child and Adolescent Health Center, where I deliver programs on mental health, substance use, diet, exercise, and pretty much like overall well-being to schools and other organizations. I lead the Community Health Leadership Program and a Digital Inclusion Program at the Child and Adolescent Health Center. I have interests in clinical research, and I'm currently leading a research project aimed at assessing the relationship between cardiovascular health, more specifically metabolic syndrome, and psychosocial factors among parents and child diets. So outside of Access, I'm the president of the Dearborn Lions Club, where I lead community projects, fundraisers, and advocacy efforts.
Thank you, Ali. And last, Hala?
Hi everyone, welcome. And my name is Helena. I graduated from Wayne State University about 1 year ago with my master's in social work, and I have a specialization in cognitive behavior therapy. And right now I'm working as a health educator with Access, and I help empower individuals and community members in order to access all the resources that are out there for them, and also empower them with the tools and skills needed in order to help prevent substance use in the community.
Thank you, guys. So the way today's session is going to go, we're going to hold a panel discussion. If you guys have been joining us, the first day we held a panel discussion. Yesterday, you heard about our youth and the PUP laws and the wonderful presentation that they put together. And now today you get to hear from behind the scenes, really how we were navigating through our work in the last year. As you hear, Hala and Ali and Rawa have all different experiences. You know, Rawa has been with the agency for over a decade, and Hala is new to the agency. So you get to hear a little bit about the differences and the different experiences through different lenses, and how we came through, I would say, these last few months really strong. I'm gonna let this move into the conversation with our panelists, and then we will leave it for questions at the end. So my first question is for you, Rawa. You've been working for Access for over a decade and have lived many experiences. During the pandemic, what barriers did you face to adjust to working virtually? Go ahead and unmute yourself.
I'm sorry. Of course, as everyone, we face a lot of challenges, but if I want to speak on a personal level, it's like being at home all the time, being away from family, friends, social activities that we always look forward after work. This was in the beginning something that we're not get used to, so it was difficult. And so this is on personal level as everyone. On working level, it was the challenges we faced. Me as a supervisor to a team, it was like the work arrangement. It was hard to do it virtually because when you're working with your team, it's better to be having a good interaction, face-to-face interaction. And this has made me fear of this new movement to home, such as how to set virtual arrangement work, how to remote your team to be on top of their productivity, how you make sure that your team are meeting goals. So how you want you, and you're worried too, how your team may not interpret some working task or orders from supervisor to a different level of the input differently. It's totally different challenges, but that's the most things I was fearing in the beginning when I start working. Okay, how am I going to arrange this work?
So what are some things you did? For example, I know people had to do check-ins or find a way to meet, to be able to like talk to your teams, because you're right. It's never easy to be on a virtual platform completely. You lose that human touch. So what are some things that you did or you guys did to get over that?
Of course, when you be in a situation that there's no choice, you come with your creative ideas. Mm-hmm. So what I did, first of all, of course, we do our weekly meeting, but we move it, instead of being in person, we move it to Team Microsoft. We see each other every week. Secondly, to make sure that we are doing the productivity, we created, or I created an live Excel sheet, which is each one of us who see clients on a daily basis. We put our productivity, time productivity, what did we do for the client, name of the client, and there's a box of feedback if we need to go back to, if we missed a call. And if we call this client 2-3 times, we want to make sure when clients come back to us too, are not frustrated and thinking that we're ignoring them just because we cannot see them. Mm-hmm. So we put those notes to ourselves to go back and follow up with those clients. Second, we make sure to call our clients during open enrollment and special enrollment. Before the pandemic, clients are the ones who's come to us. But now we go into the client by our phone calls, by making sure that we are following up our clients with case management mode, that so they don't miss or end up frustrated because they're not able to reach anyone to help them with frustration or their paper needs. Mm-hmm. For sure, like communicate. We did a WhatsApp, a team chat for questions, concerns, answer on the spot. So this is through our phone because it's next to us all the time. So we could answer each other's, we could have a feedback on work, questions, concerns. So that's most likely, we found it very, as a starting point, it was good and productive. Actually, we can see our work, you know, it's some things like probably extra work we don't need to do while you are in the office, But during the pandemic, we felt we are in the office through those processes.
That's wonderful. Ali, how about you? You know, how did you change, you know, your work changed during the pandemic? What did you do to adjust?
It changed a lot. I remember immediately at the start of the pandemic, I was in a classroom. So I remember March 11th, March 12th or something like that. Right when COVID started getting, you know, the word started spreading around. Every time it was mentioned in a class or in a school, or kids would run up, wash their hands. Remember that the following Monday, everything became online, literally that following Monday. So instead of meeting with students in person or their parents or staff, started meeting online. Assemblies and presentations became all online as well. So going from having classrooms with about 30 students or auditoriums with over 500 participants to being fully virtual. And the thing that gets lost there is that interaction, you know, that body language, seeing that person, how they're reacting to what I'm presenting, and, you know, controlling the audience, controlling the room, all that is lost. All it took was a click of a button, and now I have a audience in front of me, and all it was just my tone and what I'm presenting. So that in person was gone. And so to maintain the integrity of the in-person interactions, I had to develop like special activities, incentives to do online, whether I'm meeting with parents, staff, or students, so that I could keep them engaged. Because, you know, either they're on Zoom all day for class, for work, or for any other activities, and then they're meeting with me again on Zoom. So I try to, you know, supplement it with additional things. All right, you're not just listening to me talk. You know, I have this award, or I have this incentive, or this is what you're going to get out of this. Also, engaging in conversations on self-care and discussions of the current standing of the pandemic helped give participants and people who came to my sessions new coping strategies, and it made them feel more connected. Right? Maybe it's not just me who's feeling lonely or tired. I'm sitting home all day. I'm not going out, and that type of thing. It kind of gave people that, you know, that better understanding, building community, and hope. And hope for a better future without COVID.
Yeah, well, I've seen you live and on sessions, and you've done a wonderful job. And you know, we appreciate all of the new ways that you're coming up to keep the youth engaged, because we know that that is a tough audience. You know, trying to find ways to keep kids engaged. And the other thing that we faced was kids are on the school virtual platform. They play video games. They're stuck at home, the TV. So, you know, I know that that's something that challenges that families faced, was finding new ways to keep their kids active outside of the virtual platform as well. Hella, you started with us during the pandemic. You graduated in the early stages of the pandemic, and you took the decision to seek out a job. What resources were available to you during this time? You know, if you can go back a year and give advice to yourself, you know, can you tell us a little bit about your decisions and what resources were available to you, and what advice you give to yourself now that you're a year, it's almost a year in?
Yes, definitely. And when you said that too, just thinking about how much change has happened in this last year, I honestly did not see this coming, or like a year ago, I would not have envisioned half of what's going on right now. It's been wonderful. But it didn't really feel like that at first. So, like many people, honestly, in the beginning, it was a time of uncertainty. There was a lot of fear being spread everywhere. And part of me was really focusing on what's going on in the world, what's going on with everyone around me, and then also what's going on in my future. What does my future hold for me, as well as the rest of the world? So it was like a conflict right there. I didn't know if I should be focusing on my future yet. I kind of felt selfish at first. Should I just be worrying about the rest of the world? Do I put things on hold? Do I just wait a year and see how things are going? And honestly, at first, life is really uncertain when you finish school, regardless of a pandemic or not. And you had to really make that choice. Do I just wait? Is it even worth applying to a job? Is it worth doing a lot of things right now? And I know I'm not alone when I say that, but I think looking back, it really helped me grow helped me learn new ways of handling uncertainty, really learning how to think in creative, innovative ways, especially coming up with solutions. And I think that's something that's really useful in the field that I'm in now, in prevention. And I would say the resources that were available to me, I would say were mostly online, as for other people, whether they were already working or looking for a job. I really focused on virtual resources. So this included like job searching sites or working on a resume, being mindful also of how my professional presence was online. So creating that online presence using LinkedIn, that was something that I didn't have before. So really spent some time utilizing that resource for myself. And I really think that helped me a lot, just putting my past experiences, reflecting on the work I've done so far. And it really did help me, like when looking for a job, I wanted to see, okay, what field would I like to be in now? What would I like to do? Or do I just go back to school if I'm not really seeing like what's out there right now? So definitely virtual resources. It was a tricky transition at first, but using all those resources was really helpful. And in terms of advice I would give myself, I think advice for myself and for anyone really is to take things one step at a time, to really focus what's in my control, what's in your control, and what you can do about it right now. And instead of really disempowering yourself by trying to think about everything that you can't control. So just one step at a time was the thing I kept repeating to myself.
Well, we're glad that you made the decision to join our family here at Access. I remember when Hela started working with us, there was a point when she said, you know, I wanna be able to do things. I can't wait to like come in. I can't wait to like go on. And I said, be careful what you wish for, because we're very fast paced. And I think it was like a month in, and I'm like, okay, Hela, we got testing sites, we have vaccine sites, we have food banks, we have food drives, we have this, we have that, and she jumped right in. And so you guys will hear more as we go along about all the wonderful things and the barriers. I think that if I think back and look at it, I think about, you know, if I look at everyone that we worked around, you wouldn't know what anyone was feeling because everyone was so busy working, you know, or that we were all scrambling at some points, just trying to figure out what was the best solution. And like Rawa had said, you know, coming up with these solutions within a few days, because you had to take a team on and go home and supervise, right? And so trying to do this work has been an interesting journey for you guys and for all of us. Rawa, you know, how has your program integrated with other programs, especially on the topic of mental health? You know, we discuss different ideas of like how we integrate our programs within the agency, and how, you know, if you're listening in today, you think about how is prevention or mental health have to do with health insurance or applying for health insurance. So can you give us a little bit about the integration piece and what you see when you're helping our clients?
Sure. I always believe integration enable public health professionals and other programs to work, including mental health program, is to combine effort, resources, and expertise to achieve the shared goal between programs and improving the health of people, the population, the clients we serve. So during our through our work as navigators, enrolling people with health insurance, we do recognize some people that need, for whatever reason, need to, we could say, express their feeling. We could say they need to talk to someone. We could say, you know, that this pandemic caused a lot of stress, anxiety, instability of what they want to do or what they can do. So we do encounter people like this, and people feel comfortable enough to ask us if there is a way to talk to someone. But mainly our job is to always educate those clients, whether they approach to ask for mental health or therapy or quit smoking for SUD program, whatever. Our job as educators, whatever you're educating people with, is to make a recognition of access programs and let those clients take advantage of. Our programs are, most of our programs are free of service, and we will love our community to take advantage of those resources that we work hard and hard, each one of us, to provide those resources to our community for better health lifestyle or make their life easier or whatever. So this integration, when we encounter, let's see, clients like this, we, of course, we are very well informed of other programs at Access. So we do refer clients through the protocol, whether, let's see, mental health, there's an evolve assistant that we could refer clients to and send them to the right person. Quitting smoking and whatever it is. But we always advocate our clients through our programs with the other, specifically with the pandemic. Specifically, we increased this awareness during the pandemic.
Right, like Ali, your program, you guys are stationed in the Access Clinic, and as you know, sometimes you'll see people come in through the clinic for certain programs and they need other programs. You might have students that are in your schools and then their parents reach out to you that they don't have health insurance or they don't know how to navigate the health system. So these are ways that you guys have integrated your programs. And it is, I'd say it is very helpful to know that these programs are at your disposal, right? Like it's just an email away or a referral system away. So Ali, what are some ways you continue to reach out to youth? Like I said, the youth was the one component during the pandemic that was a very tough part, not from them really. It was just the idea of, how are we going to, because as adults, right, we're supposed to have the answers and we're supposed to know what to do and how to react. And we're learning as we go, correct? And so how did you do that? How did you continue to work and tell us some unique ways that you've been continuing to do your work with the youth?
During the pandemic, until now too, it's been mainly electronic. So for example, if I try to reach out to a family or to a student or anyone, it's been through like phone call, texting, emailing, sending out reminders and that type of thing. So with students in particular, it's been tough. like what you said, and a lot of the schools, they've been also having trouble with attendance to start with, and so for example, if I reach out to a student and I might not hear back from them, maybe because they're busy or they're in class or they're doing something, there's different ways that I could get my message across to them, whether it's reaching out to the teacher or depending on the message, maybe the principal to reach a larger audience, or maybe directly to the parents. Just to keep them engaged throughout the process. And so also on occasion, I've met up with students, while maintaining safety precautions and that type of thing, where I passed out incentives and awards, where we get to actually see each other in person and not just on camera, kind of built that greater connection between us. And so I heavily relied on building that strong relationship with these students from the beginning, from when they met me and when programming started, so that I wouldn't face that much trouble when it came to engagement or participation later on. So for me, it was keeping them engaged, providing incentives and awards for their engagement, and just giving them expectations and that type of thing throughout. At the clinic, we have been doing a lot of things actually to keep the community engaged, whether it's vaccinations, whether it's COVID-19 panels, or whether it's the giveaways or the vision screenings that we do. So we're always doing different types of things to just keep them connected with what Access is doing, and to give them that greater sense of community, all right? It's not just going to class all day on your computer and then maybe playing video games, watching YouTube, social media all night. There's a lot of things going on. Hopefully we're going to get back to normal soon.
Yeah, I know that you had some sessions in some of the schools, and tell us a little bit about that. I heard that the kids really were just excited to be outside of the class, in the sense of like learning something, where they had to listen into the math class or the science class. Your sessions were an opportunity for them to connect with each other, which was something that they can't always do during the regular school hours.
Yeah. So during the pandemic, I mean, I keep saying during the pandemic.
Yeah. During these times.
Yeah. During these times. It was very important to give students that space to share what they're going through, their thoughts, their feelings, and to build that sense of belonging, that community outside of just, all right, this is my camera and that's the teacher and these are my classmates. Because like what you said, if they're learning math or science or history, that's what they're learning. They might not have that space to actually talk with each other. I don't know if you remember back in the day when we used to walk in the hallways and, talk with each other, or in the cafeteria. A lot of that went away, especially when students are, all right, let's do an hour of science, an hour of math, and then let's give you a little break here, and then let's come back. So giving them that space outside of the regular school hours, or even it could be during school hours, where they're engaging in that hallway talk, that just building relationship type of conversation, helped a lot of students really feel more comfortable.
Yeah. One thing I know from personal experience is my son actually started middle school during the pandemic. And so he was going into a new school mixed up with kids from different elementary schools. So he didn't know everyone. So he would look on the camera trying to find a familiar face, hoping he knew one person in the class. And I just remembered just going to middle school in person when I was in, way back. Was scary for me because I was so used to, like, when you're the oldest kid in the school, like you feel like you know everyone. Then I went into a school and I'm one of the younger kids, and I don't know anyone. And I didn't realize that he was facing that virtually, right? And so he'd get super excited just to see like one person, if he knew one person, or if he might have known someone, or someone he knew that knew someone. So he would get excited, and it's like it was a very challenging time. And I seen how excited they got when they were given the opportunity to hybrid learn. And so unfortunately, I know during hybrid learning, a lot of the after school programs, like your health education programs, was still not something that the schools are prepared to bring us back in person yet. So hopefully, Ali, I hope the kids get to engage with you in person in September. You really are a phenomenal health educator. And I think that the youth are very lucky to have someone. So you really find ways to engage the kids in their own language. And I find that to be a very unique trait in people. So thank you so much. Hela, like I said, you started working in Access during the pandemic. As you reflect and as you witnessed the agency during a pandemic, what are some things that you think the agency did an amazing job on? And what are some things that you feel like we faced as barriers?
That's a great question. And when I'm answering this too, I ask anyone viewing to really think about themselves, their agencies, or their places of work, especially during these times, during the pandemic as well. And I really want you guys to think about how adaptive were you, or how did you handle the barriers also, and your resiliency, because this is something I was reflecting on in the beginning when I began working at Access, just trying to see how were they handling the barriers, how could I be helping with that. And when I began, it was really around the time there was a lot of vaccine sites or testing sites going on for COVID testing. And this was happening outdoors. I remember people were in their cars waiting in those types of lines because we could not be next to each other without being very socially distanced, especially then. Just wearing like 5 different masks all at once. And I remember also being part of the food drives too. Sometimes there was food being given out, especially during the holidays, especially during Thanksgiving too. That was one that I worked on. And I really think the agency never stopped serving the community, even when you would expect them to just stop and focus on themselves. I think this really pushed them further. And they were still finding new adaptive ways of helping others, whether it was using virtual resources, whether it was increasing the amount of webinars going on when usually we would have been holding them in person. And they also did this with a lot of communication. There was excellent communication with community members and among the staff as well. So making sure everyone's well-being was being taken into consideration. And it was honestly a great first impression for me. And this is something for all organizations to really keep in mind whenever they're wondering how to adapt to any kind of change or uncertainty. And honestly, I think they handled the barriers well. There was a lot going on, a lot of resources we could have access to. So overall, it was great, always thinking ahead and trying to see what next steps can be taken.
Yeah. There's something going in the books, I would say, especially that turkey drive. That was one interesting time, but it was a very fulfilling time. You know, Hella, you did a lot of work with our youth groups when you started working with the agency. What are some things that or events that you guys did to stay engaged or to keep the youth engaged? What are some ways that you stayed engaged with the youth group for the coalition?
When I began my work with the youth group, they had previously been meeting in person, and I never really got to work with them in person when I began. So it was on a virtual platform. We used Zoom and making sure to be in communication over WhatsApp, messaging, making sure that we're in constant communication. And then also they had their own schedules, whether it was school or having a part-time job, and just having to be adaptive with that, making sure we couldn't hold meetings on a set day every week, and that was okay. Just accommodating for every group member as well, just to keep them engaged, to keep them feeling like this was some sort of commitment that wasn't just another stressful thing for them. So we utilized that in order to keep our meetings going regularly, once every week, using Zoom. And then also if we wanted to do any fun activities, whether it was for prevention days, so the substance use prevention national days that go on. For example, Red Ribbon Week, where we speak about the substance use and then violence prevention as well. So instead of having an in-person event, we created flyers virtually using websites online, sharing my screen, and then getting the youth's input. And then we also were able to give those flyers out during one of the food drives that we had. So it was really creating things on a virtual platform and then also playing virtual games. So having to really be creative and think of ways to maybe create a Jeopardy type game using substance use prevention facts when we usually could have been playing that in a classroom, for example. So using virtual games, really trying to think of different and fun ways to do so instead of just showing them a video and losing their interest right away. We also really used a lot of virtual conferences. So they attended CATCA, which is a national forum that happens, and they were able to get trainings and learn new information and develop their leadership skills. So we made sure to also, any opportunities that were out there to see any type of virtual conferences or any kinds of webinars, to make sure we were attending those. We even presented the youth, and I also presented as well in these types of events. Or we also continued our advocacy work too, I would say, virtually. We really met with different city officials and state officials and represented all Michigan coalitions. They were the only youth to represent all Michigan coalitions virtually during CATCA. So we made sure to always keep in contact, making sure we're always trying to think of new activities and new opportunities for us to constantly attend, whether it was virtually. So that didn't really stop us from continuing our work.
And of course, you guys face barriers. I hear it all the time, changing of meetings. And I think that the one thing we can all take back is flexibility is key right now. You know, of course, it's a general, you would think maybe a 9-to-5 job, but in reality, especially during a pandemic, I don't think that was existing. And I think that everyone was willing to continue to do what they had to do to get the work done. Rawa, the amount of things that I have witnessed since I started working with you, but in the last year during the pandemic, the creative ways that you came up with to continue to serve our community are remarkable. You are someone that we can all learn from. Rawa's program, as she mentioned, is about navigating health systems. And as Hela mentioned, you know, we did a prevention event during a food drive, and Rawa was like, okay, explain this to me. educate me what this is. And she started talking to people that were coming through the food drive about, this is Red Ribbon Week, this is what we're doing. And, as we are educating our community, it's key that we educate ourselves within the agency. And so we all learn about each other's program, cross-training, cross-understanding of each other's programs, and how can we make sure that we know what's available, right? Because these can all be available right in front of you, but if you don't have an understanding of what they are, you can't give this information to other people. So Rawa, can you tell everyone about a few ways that you continue to do work, especially some of the unique food drives that came up during the pandemic, and as well as like outreach for the Cigna program that's new, and then with the Navigator program?
Like you said, we all work as, the great thing of working under Access is we all united. We all get involved with each other programs. There's no program for one. We are all for working for an agency that have one big, huge goal, is serving the community with whatever resources that we can make it available to them. So during the pandemic, which is, if you want to think about it, it's far from my field as making sure people have health insurance. I don't look at it this way. I look at it as what they need, and I'm able to do so, this is what I'm gonna do. So we did a lot of food drive event, which I made my home as the, you could say, the garage where clients used to drive through and give them the food while they are in the car. And me and my team work with most, you could say, most of the mobile testing that in the beginning of the pandemic that Access was providing all over the cities. Me and my team and other teams were in there doing an outreach, promoting the programs, screening what the people they need. And the thing is, we were really screening in a way, when we come back to our offices, we were distributing those names and numbers and sorting what they need. Like if I see someone's need food or voucher, it will be sent to Mona. Mona will be sent it to social service. If I see someone needs health insurance, whether Medicaid, I send it to my team. If I see someone needs a help in the clinic for specific illness that the clinic can provide for free, we send them to the clinic. Mental health. So our events were mixed, a big, huge combination of people needs during this pandemic, and we were eager to help them in any way possible. Whether we even opened on Ramadan, we made it accommodation for people to take the vaccine after iftar. As you know, people fasting during the day, and due to their culture belief, they don't want to take the vaccine shot. So to give this availability for people, consider their culture. So we did an event at night. We come back, we work 9 to 5. It wasn't 9 to 5, as Mona said, never Access was 9 to 5. So we will go home just to change with the flexible clothes, just to come back to the office and serve the community until 1 o'clock in the morning with a smiley face, with an open heart, with understanding to their frustration, to their fear from the vaccine, because we pass it through ourselves. I was the ones I was in the beginning hesitating, no way I will take the vaccine, no way I will accept, no, there's not enough research about it, there's nothing. But working under Access and being more involved with what's the vaccine about, and how just to make yourself feel safe, at least you're protected. And since I took the vaccine, I really feel, even though I follow the precautious way, but I feel more safe than ever. So we did a lot of promoting day and night. Whenever they ask us leadership, our clients, they need us, we were there with everything. And I'm glad, and I will be willing today and after be serving my community through Access.
Thank you, Rawa. And I agree. Yes, it's never a 9 to 5 job when you work and working to serve people. Ali, can you tell me what advice would you give to others that work in the same field as you? How do you personally, with all like with the quick changes like that happened in the last year, what advice do you give to people that are health educators as well?
I mean, the first thing that comes to mind is maintaining and building relationships. Let's say with community partners like schools, businesses, and other supporters of the cause that you're doing. So for example, if I have an event or if I have something that's going on, based on the relationships that I've built already, it's quick. They know the type of work that I do. They know the type of services that I deliver. So I wouldn't have to go through the barriers of reintroduction, building a relationship before they start advocating and supporting my type of work. So building relationships is very important. So you have that network you could rely on, immediately sharing things with people, getting that support as fast as possible. And following on that, I would say staying consistent and taking things one step at a time. Sometimes it might be overwhelming, especially when you have all these different places reaching out to you to do programming, and you're trying to figure things out. Taking it one step at a time, having that schedule structured where you're able to see these schools and do all this type of work. And just on the point of staying persistent, sometimes you might reach out to individuals. Sometimes you might have programming or projects that might be on the back burner for others, maybe not for you, but for others. But staying persistent, giving it that constant support so that it doesn't fall back for you as well. And on the point of taking it step by step, during this last year, being zoomed out is very, very easy, very common, especially when you have presentations, for example, or you have meetings throughout the day, or let's say you have schoolwork, or let's say you have an event going on. Sitting in front of a laptop or screen from morning till when you finish work, or even till after, and then maybe let's say you stay on it for entertainment too, or to communicate with others, is something that I experienced. And so to deal with that, I highly recommend recognizing the importance of self-care, taking those breaks to recharge, which will hopefully push your long-term performance and your longevity in doing that work. So for me as a health educator, I also recognize that I want to deliver these programs to improve the well-being of my community, but at the same time, I have to focus on my well-being as well. If I do a presentation for an hour, taking a couple minutes or so, 5, 10, 15, 20 minutes, walk outside, take a quick break, do something else, refresh, get back, see what else I have to do, and that type of thing throughout the day is important, and something that I highly recommend to everyone, not just health educators.
Thank you, Ale. I agree. I think that we're always run, go, go, go. And then you start not feeling well, or you realize like, you don't know why you're tired. Or there was points when I would be like, I don't even feel like talking to anyone outside of like after work. So I agree. Self-care is very important. I think we all have to remind each other of that, because you as yourself might forget. So you have to remind people, clock out, take a break, breathe, smile. It will find a way to work. We have a team member who always tells us it will work itself out. Hela, so prevention, what did prevention provide during the pandemic? What tools or resources did you utilize?
Mm-hmm. Yeah, especially for the prevention field, there was a lot of barriers that were present for it. And just as many barriers as there was also the same amount of resources, if not more. So I would already say that the prevention field is very dynamic. It's no stranger to change, especially as the social climate around it changes. It's never the same. It's always trying to think ahead, and it's always improving itself just to help others. And this can really be said for any field that is dedicated to helping others. So the pandemic, I think, forced every single field out there, every system out there to change to some degree. And I would say the prevention field did handle the barriers well. And we saw this through the usage of more virtual resources, a lot of innovation that happened by thinking of new methods of addressing substance use. And also it opened up our eyes more to other factors that could be addressed when we're working on substance use prevention. So traditionally just speaking about preventing, let's say, tobacco use among youth. But now with the pandemic, we were also taking other factors into consideration. We were thinking of other factors that needed to be addressed as well. So isolation, being at home a lot more due to everything switching to a virtual platform, or again about self-care and mental health and physical health too, especially if we're not being as active as we once were. So when we're giving our presentations, when we're just at one point just saying all the tips out there to prevent students, for example, from using substances, we now incorporate other factors. We do presentations that help students learn about different ways to implement self-care, about different ways to engage with others, even if it is virtually, and also about video gaming and reducing the screen time or being more mindful of the media that they are consuming, because we can see that all these factors are related to one another. When we're trying to prevent substance use, we don't always just address substance use. We address all the factors, taking a holistic view of it, of the individual, of the community, and really trying to address all the points that are out there that could eventually lead to substance use. So making sure we're preventing it from every single angle when we previously maybe weren't doing that as much. And it also, I would say, provided us the opportunity to reflect on all the areas we could have been improving in, or all the tools and resources that we could have been utilizing a lot more from the start. So such as social media or using webinars and things like that, just to reach a wider audience. So that was like the main improvement there.
Thank you, Hela. Well, the last thing I'm going to ask each one of you guys is, you know, we talked a lot about your work and how you guys serve the community and we're able to adjust to a virtual platform as far as work. But I want to ask all of you guys is, how are you guys? You know, how are you guys feeling? How did you guys feel? What are some things that helped get you through or getting you through what, like Ali said, it's still going on, right? Obviously, we're hoping we're in the positive, back to whatever's considered normal direction, especially now that some of us are back in the office on a rotation, which is really nice to be able to see each other face to face. I can say my favorite thing about being back in the office is I can just physically ask someone something versus an email or text or a phone call. So I like to, I've been walking a lot in the office. I get up and I walk and just ask a question and I go sit back down. And I could have probably sent that as a Teams message, but I'm like, no, I want to go ask that person the question. It could be anything, just because I'm happy to physically see people face to face. So Rawa, how are you? What are some things that, you know, how did you get through these last few months and year almost?
Honestly, like you said, when in the beginning, and I said that it was really, it was a shock more than okay, what's going on? We didn't we didn't believe it. I personally did not believe it in the beginning. I thought it's like a news illness on a news, they make it big, and okay, we'll get over it, you know. But gradually, when it start elevating month after month and being in a real world that you have to be isolated, you have to be away from this, especially with the home instruction. I have an adults at home that it's hardly controllable in every age, you know. At this age, it's hard to them to let them know, Mom, you cannot be close to this, you cannot do this, you cannot be outside like this. And they don't want to be trapped. At the same time, you want them to stay safe and not to bring illness. So this is anxiety. This is cleaning all the time, wiping all the time. We even get to a point that oh my God, we have no more Lysol. We have no more this. We have no more paper towels. So we were having anxiety in all levels. What keep me going on? The only thing is, to be honest, of course, family support. Second of all, work. Because we were not the organization that stopped working, this part made me feel still alive, still on a north, even though I'm home, but still made me feel that I have a past I'm still in. There's a work that I used to live in the past and I'm still living in with this pandemic. Honestly, this part made me still want to continue still alive, because it gave me a chance from here and there, the leaders, to talk to them, to see them, to my colleague, to my friend. Okay, I'm still here. We're still here. I didn't lose everything, you know, even though I'm isolated, but they made it for us to have each other, support each other in a way, even from home. So just going through one united work, when you'll be able to see someone or speaking to your colleague in a turkey drive and a mobile testing and a vaccines, made me survive. And I'm glad I survived until this time, and I'm back to the office, arranging everything, and start seeing my friends knocking to drink the coffee. So that's a good feeling.
Yeah, I agree. I think that was a reality check for some of us. I remember when everything went down and we all was at home, and we were trying to find ways to keep my boys busy in the house. And my husband's like finding new ways to keep them busy. And then I looked at my kids one day and I said, you guys really don't realize how blessed we are. Like, your parents didn't lose their jobs. You know, we have to adjust to all being in the home, and we might be busier now because obviously with me working with the nonprofit, and then, you know, my husband's work didn't go anywhere either, even though we were both at a stay-at-home order, but we were both working. And I remember looking at my kids and I'm like, everything I hear every single day of families who got uplifted, you know, people who were working, people had health insurance from their work, people were going to a job, you know, every single day, and then it stopped. And now these individuals are applying for benefits public health aid benefits that they didn't even, some of them didn't even know how to apply for before, or, you know, we're trying to navigate that system. And so it was a moment of, you know, to check my privileges, to have my kids understand, you know, how blessed you are, because one of the struggles that we had to feel was just staying safe, right? You know, we had our roof over our head, we had our jobs, but it was just about staying safe. And as Rawa mentioned, I think that's where my trust came into play with getting vaccinated, is that I felt like it was my due diligence to keep myself safe and to keep my people around me safe. And I really, it's interesting because I'm not someone who's really never been vaccinated for the flu or anything. And when it came to the vaccine for COVID, I just took it. And I just remember people looking at me like, really? And I'm like, yeah, I'm just going to do it. If I have this opportunity to do this and to get back to more normalcy of working and more normalcy of helping people, I'm just going to do it. And I'm just going to go for it and see what happens, you know, like put my hands in the air and just see what happens. And I'm grateful ever since, because again, I did feel very privileged to get the vaccine when I received the vaccine. And of course, you know, everyone has their moments of understanding about it, but yeah, you're right. As much as I love my family and the support and everything, I'm a workaholic, and just to know that and because of the type of work that we do, I think when you make a decision to work in the nonprofit field, for me, especially in the prevention field, as you can hear from Ali and Hela, being able to educate people, being able to bridge those barriers is something that is priceless. Ali, you talked about self-care, you know, and you're always talking to people about self-care, but what do you do for Ali? Like, what have you done to adjust through the last year?
I think it's been highlighted. Main family, friends, colleagues, having that outlet, that communication, maintaining all that, having someone to speak to helped me a lot. Taking those breaks, between work, between sessions, going outdoors. But to be honest, I think my greatest support system was having, my close colleagues, family, and friends, and that support throughout the whole process. Because, like what you said, we have that passion to support the community in the work that we do. At the same, it can get tiring, but having that background support, that background voice of, you're doing good, keep going type of thing really help. And, what I'm hoping is, in the future, out of the pandemic, what comes out of it is, a better brother, a better partner, a better worker, a better someone, because of these interactions that I've had. And not just for me in particular. I'm hoping it's for everyone too. A better husband, a better wife type of thing, better teacher, because I think it allowed us to see things in different perspective. Like what you said, seeing families lose their job or their insurance, and knowing the opportunity, the privilege that you were in of having your work and working at home, kind of changes perspective of things, and how we live and how we appreciate things and that type of thing. But yeah, I'd say family. And it might be something that others might not share, but also being physically active outdoors when it was nice. Yeah.
Thank you, Ale. And Hannah.
I would say what got me through everything and would be really self-reflection, or working more on myself, in that kind of sense. Because I'm okay now, but I know it wasn't always that way, especially in the beginning, and that's okay. Especially with my background too in social work and cognitive behavior therapy, you kind of learn and you know how to use all these tools that are out there. You know how to help others in any kind of helping professional. But when it comes to yourself, you might not be so readily able to help yourself right away. So you know all these things, but you really don't have that push to apply them to yourself. So I would say this whole past year really forced me to do that, to continue to improve myself every single day. And I would say I'm a completely different person as I was last year, and I continue to change more and more for the better every day. So really taking that time to work on yourself is something that really helps in times of uncertainty, to really strengthen the parts of you that can get through things, your resiliency, focusing on all your strengths, and acknowledging your weaknesses, and they're okay. And just accepting them was the number one thing that got me through all this. And it's something I advise for anyone out there who might be struggling with something, to really just focus on your positive skills and strengths, and acknowledge your weaknesses, because in the end of the day, they're going to end up being the strengths that get you through anything.
Thank you, Hella. Right, we are at our question portion of this presentation today. If you have any questions for our speakers, feel free to either put it in the chat box or unmute yourself.
Hi.
Hello.
How are you?
Good.
Good. Just wanted to say, Rawa is my new Middle Eastern twin sister. Everything she was saying, I was like, yes, yes, yes. I totally agree with you. Just wanted to ask Hala, what kind of virtual games, she mentioned Jeopardy, and what other things that you created for your young people to be engaged? Because we're suffering from Zoom fatigue, but if it's the content is good, you still will tune in. So what kind of, and did your young people create the content?
So yes, they did create the Jeopardy games that we had. We also had different game show style type games. So whether it was Who Wants to Be a Millionaire type of deal. So it was really game show type games and presentations we used. We used a PowerPoint format. There was also online games as well. Or we also used trivia, a lot of trivia games that were easily available online. And we also did create our own trivia type games. And I also think I have a list of different types of virtual games we did create, and I could definitely send you that in an email if you would like that. It'd be in greater detail too. We have different ones that we use. Perfect.
Yeah, thank you. Angela made a very good point. I'm a huge traveling person, and as I say, you know, we all love to travel for the most part, and that's a big miss for many of us. A question is, what are you guys looking forward to after the pandemic? What is the first thing you'll do if things go back to normal?
I would travel, see my sister, my twin sister, definitely. So this is my always, it's like every year things. And I was so worried if I'm not able to see it. I took the vaccine hoping that in the future, close future, I'll be able to go and see her and visit my parents' grave too.
How about you, Ali? What's the first thing you're doing?
Say travel too. I miss the traveling, the going to new places in particular. I'm hoping now with more people like getting educated on it, on COVID-19 and vaccinated, that'll be like more safe to travel and where I feel more comfortable traveling and that type of thing. So right after, book a trip somewhere and relax. I haven't done it in a while. My plan was I had a travel plan. I believe it was in the beginning of April of 2020, and everything got canceled. So looking forward to that probably next year.
Hopefully. How about you?
I would say again, traveling is the number one thing I've been wanting to do this entire year, and traveling comfortably, that is. And also maybe going to more indoor places more comfortably. Like I enjoy going to different types of museums around the local area. So being able to do that in a more comfortable kind of way and not having to wear a mask, especially when it's hot outside. So really just going back to places, definitely.
Well, thank you guys all so much. Thank you to everyone who attended today and to our wonderful speakers. It's a year in reflection is the best title I could have thought about for this session. We went back and forth about the session a lot. And then the day we sat down with the speakers, as we were discussing everything, I'm like, we're all reflecting. And it's a time where everyone's just reflecting and hoping for a positive future. And you know, it's like a moment when you realize you're surviving a pandemic. And you're giving back and you're working hard and you're doing what you can do to serve the community. I do want to say that we know, all of us, that with all of the work that we've done and reflecting on all of the work, we have to believe that this is a key component is our partners and our funders and the support of each other. You know, when we hear from people from different organizations and coming together, and talking about how can we work together. I know in prevention, we realized the importance of the coalitions from throughout Wayne County coming together, supporting each other, finding out, what's going on in your city, what's going on in our city, what can we do to help each other. It is very important to understand that these type of barriers or challenges are being faced across different cities and across the nation and across the world. And this pandemic was one that really made us realize we all faced it and we all have to find ways through it, along with the fact that we had the barriers of SUD and mental health and suicide, and then those increasing during the pandemic. So adding a pandemic inside of a pandemic is a challenge. And this is why, it's important to work with your partners, work with your funders, and to make sure that your community is on the map. I think it's very important. I think that we try to do this very well is to educate others about our community, especially when we are in the community of, for the coalition of, we serve Dearborn in Dearborn Heights, which is predominantly an Arab American community. And when we're working on that, we have to also look into research and surveys and focus groups to have a better understanding of how stigma or what prevention factors or preventative factors or risk factors do we have to provide, or what are we facing? You know, so you have to make sure that you, of course, are looking at all the tools that are available and utilizing them, but make sure that they are culturally sensitive and make sure that they are unique to your community. So again, thank you to our funders and to our partners and today's speakers and attendees. ASAP Coalition could not be where we are today without all of you guys. You know, we're very happy and proud to be where we are today. I think it's been a journey in the last 5 years, and especially reflecting on the last year. So thank you guys all. Have a wonderful evening. I look forward to seeing you. We have 2 more days. Tomorrow you get to hear from a coalition from California. Angela is the CEO of Delta Prevention out in California, and she's also a CADCA trainer. And we will be talking about utilizing and sustaining your relationship with the faith community and the role the faith community plays in substance use prevention. And then Friday, we're ending our week with what we've been talking about, mindfulness and self-care for employees, especially people who are working in this field. So tune in tomorrow and Friday at the same time, and we will also be Facebook Live. So thank you guys again, and we'll see you tomorrow. Have a good evening.
Thank you.
Thank you, everyone.